So I would like to introduce Niki Graham. She has degrees in health enhancement from Montana State University and a master's in public health from the University of Montana. And right now she serves as the director of the Center for Prevention and Wellness for Salish and Kootenai College. She's known for her extensive knowledge on sexual health, her creative, compelling talks on reproductive health, and she shared her work at national conferences, but primarily she works with local communities in Missoula in this area, spreading knowledge to students and people of all ages. So, yeah, thanks, Niki.
All right. Yay! Everybody gets the clap, so we got to talk about chlamydia too. So, well, I appreciate the invite. It's always an opportunity, and even if there's just a small crowd, that doesn't really matter to me. I think all of us have something to learn in some way or another. The activity that I'm going to share with you today is an activity that I've done with people of all ages, from as young as 10 all the way up to 92. So, and for everybody, it makes a different impact, whether it be a mom who's sitting beside her daughter. In my case, my daughter's joined us today, who's also gone through this activity numerous times. But for that conversation that's developed from the activity, from that to the conversation that spreads from what you've learned today to wherever you may take it. It's really, I think it's always important to understand what's going on. For girls, I tell them you get one vagina, so you got to take care of it. And for guys, you get your penis, so take care of it too. And there's always going to be consequences out there, but understanding what those are and how to better take care of ourselves is really important. So what I would like to do with you guys is just let's run through the activity. Let's see what it's like, and you guys experience it, and then we'll have some talking about it. But before I begin the activity, I'd just like to hear from you. Who are you? And then if there was something that you would like to hear today or tonight, or even ask, what were your intentions in coming that you wanted to kind of take away once you saw the talk and you came in because I already asked you to come in or whatever it may be. So do you mind if we start with you?
I'm Eileen Patton, and I work in finance. Okay. And I'm just kind of curious because I've been married for so long, and who knows what's out there. And
what might come home even, right? Yes. Okay, that's fair. Yay. Even people that deal with money deal with struggles, right? Whatever it may be. So, all right, perfect.
Okay, I'm Allie. I'm divorced after 25 years, and I too want to know what's out there.
Yes, okay. Well, we all have different struggles in life, so yes, the divorced people I get to work with often. The recently divorced or the recently found out something's been going on outside of what I thought was a monogamous relationship, so what is that like now? So thank you for coming.
Sure.
I'm George.
George.
Construction worker.
Okay.
And Ari told me to show up. So.
Okay, and you came. All right, so you get, that's all right. You're not the only guy here, so you'll be all right. You'll be fine. All right, let's jump to the back side.
I'm Pam. I'm receptionist here at the Y.
Okay.
Been married 44 years.
Congratulations.
Yeah, separated for 6.
Okay, fair. It's all good.
Before you speak too soon.
It's all good. Yeah, relationships are tough.
And just curious.
Curious, all right. Okay.
Things have changed in 46 years.
Yeah, there's a few more things out there.
Maybe.
Just a few. All right.
I am Brenna, and I like talking about sex.
Okay. Sounds good. All right.
I'm Connie, and one of my coworkers, Rebecca, said that she had been through your presentation and thought she knew everything and learned so many new things. So I want to learn those things.
All right. Okay, so open mind to find out some new things. All right, my dear, we're just going around introducing ourselves and then something you wanted to take away from tonight.
Sure. And Daisha, Ari put in a really good plug today that it was a lot to learn, so curious.
Okay, to find out what I can give you.
Yeah.
Lovely. All right.
Cindy and Olgita Sweeney said that you were a great presenter, And I think that there are very few opportunities to have real intentional conversations about sex. So I think it's a great.
I would absolutely agree with you. Absolutely.
Introduce yourself.
I'm Caitlin. I'm her daughter. I come to these all the time. I basically know everything.
Yep. So our dinner table talk is a little bit different than probably some of the dinner table talks you may have had, and some of you have opened up those doors. But it's been a whirlwind for me to learn too, and especially as Caitlin has grown. How do you talk to a 10-year-old versus a 12-year-old, to the 14-year-old, to somebody who's now dating and in the field or whatever it may be? So I've grown too in that, and now I've got a 12-year-old son, and then a 9-year-old son. And then my 43-year-old partner, who is much like a son, and that I'm still working on raising him too. So I've been married 20 years, and I think it's one of the toughest jobs I've ever had. I think that relationships are awfully tough. So whether it's a separation or divorce, I think that, it's just, it's part of our game, but they are tough. And when you add sex into that, well, then we add a whole nother ball of wax into it, especially when it comes to not knowing what we might be carrying and what's going on with our bodies. And so a lot of my work has been on the reservation, and so I grew up in Ronan. I was born and raised there, went to Montana State, and then taught in Nevada for several years, and then came back to Montana. When I came back, I was looking for a health and PE job, which is who I was before, and you have to wait for PE teachers to die or retire. So that happened after a period of time, not the death, but the retiring, but it just wasn't a good time for me to make that transition back to education and being in the classroom. But so this is like my joy. This is where I get my energy from, is giving the opportunities to teach you guys something, and hopefully you can take it out into the world, or to your tables, to your families, to your nieces, nephews, or grandkids for that matter, because I deal with a lot of grandmas. In my neck of the woods, I've got a lot of grandmothers raising their grandchildren. And so I've had grandmothers come in and say, I want to know about these condoms. Like, what do we do? I want a bowl of them in my house. So, and I say, that's fine, Grandma, you can have a bowl, but you need to know how to put it on too. And so that kind of scares some of my grandmas, but that's okay. They will sit down with me and we'll do a condom demonstration, and she's got it figured out, and I'll give her Woodies to take home, and she'll run through the demonstrations with them and then bring back Woody and say, yep, they're all trained, we got it. So that's amazing for me to have that happen. That never happened as I grew up. The sexual health was a little bit different. We didn't talk about it because the school, it wasn't allowed in school, because if you said the word sex, I was pretty sure that was going to happen. And I'm sure you guys are familiar with schools that kind of feel the same way, right? So that's a little bit about me. I enjoy doing these talks, and I'm open to questions. So, and if I don't have the answer, certainly I'm going to try to find the answer. And I won't say that I'm the expert of all experts, but my hope is to give you an experience to where it makes you think about things, and yet kind of run through what the process really looks like in our healthcare system, and maybe even with partners, and how that communication may occur. So we have 2, 4, 6, 8, 10. And then, do you get to participate with us today, or you're stuck? Okay, maybe we'll come to you then to do this. So over on the table there are a number of medicine cups, and most of them have water in them. But there are some that may have a chemical, okay? So I'm going to warn you off the get-go, so be careful as we're doing the sharing of these. You might see something with something different in it, and I just ask you just to grab the front row, and then we'll move to the next row, and then we'll stand in a circle, and we're pretty much, and then I'll walk you through the rest of the steps, okay? So if you'll come over and grab a medicine cup. Grab from the front, and then we'll come over, maybe we'll come out to this back corner here, where we have a little bit more space. Will you be my first partner?
Sure.
Okay. Don't be afraid of it. Just go for it. You got this. We will promise not to spread any rumors afterwards.
What's that? Yeah.
How are you feeling? You're looking at yours. Do you feel okay? You're nervous? Okay. That's fair. All right. So let's just take a look at your fluid. This activity is called sharing bodily fluids. And so as you look at your fluid, anybody got concerns, thoughts? What are you thinking?
I
I'm concerned.
You're concerned, okay? And for what reason are you concerned?
It looks different than I expected.
Okay, you didn't have any idea coming into this that was going to be the case, right? But now something's different. Okay, anybody else? Does it look good? Clear? Do you see any symptoms?
No.
No symptoms? Do you smell anything? Okay, all right. Okay, so what we're going to do is I'm going to ask, because of the size of the group, we're going to go with 3 partners today, okay? And what we're going to do is I'll demonstrate first, and Ari will be my partner in crime today. And then you'll do the same, but I'm going to ask that you get around, okay? It is not Ari, Caitlin, and one other stay close. I would like for you to move and mosey around, okay, to make it more realistic. Because although I realize that some situations happen in very tight groups, that occurs. I would like to, in order for this demonstration to work better, I'd like for you to get around. So this is what you're going to do. I just want you to turn to your partner, and I want you to share something about yourself that you're willing to share. All right. So I'm going to Hawaii at the end of July.
Oh, I saw a puppy today.
You saw a puppy, okay. So then I'm going to dump my fluid into hers. She's going to dump it back. We're going to do this a couple times. All right, so we're just switching our fluid. What do you think this is demonstrating?
That you're sharing fluids.
Swapping of fluids.
We're having an encounter, okay, where we are sharing of fluids, okay. So we say thank you, that was kind and awesome, okay, and maybe short-lived, but that's all right, okay. Now it's up to me then to go find somebody else. Threesomes are not allowed in this case, okay, so otherwise it makes it really tough to figure out who's going where. So would you please find a partner?
We haven't shared yet. Are we supposed to share?
Anybody? Okay. All right. Go ahead, Harry.
Ari, you are.
Oh, wait. Okay, when you're done with that partner, say thank you and find somebody else.
You're awesome.
You were good. Would you like another partner? Okay, tell me something about yourself.
I need to go home and see the dogs eventually.
Oh, that would be important, otherwise you might have a mess. Okay. I have a dog as well, but we have a doggy door, so I don't have to worry about the mess so much. Yeah, it's not always easy, but the cats get through the door, so that's nice too. So it was nice to meet you. All right. 3 times. Yep, 3 times. Would you find 3 partners? Would you like to be my partner? All right, tell me something about yourself.
I'm going to have dinner here.
Nice. Where are you going for dinner? Tomorrow. Oh, to her. Yay. Oh, home cooked meal. All right. I don't know where we're going for dinner, but I was thinking about trying the native wings, the grill wings thing.
Okay.
Have you heard anything about it? It's on Reserve Street. Okay, so I'm going to figure out if that's a good place to go or not. But it appears that Popeyes is pretty popular right now. Yes, it's going to be popular. There was quite the line there today, so it was nice to meet you.
I know anything about myself to share right now.
All right, is anybody looking, single and looking? Need another partner? Who messed up?
Oh my goodness.
Who are you? Oh my. Where have you been?
I've been lucky.
You've been lucky? Well, some might consider it lucky. Yes, that is true. All right, so before we started this whole activity, I asked you to take a look at your fluids. Has anybody got a concern now, or how are we feeling now?
I'm concerned.
You're concerned. Okay. And for what reason?
It looks very different.
It looks very different. Okay. All right. Is there a certain partner that you're suspicious of?
Boss lady over here.
Okay. That seems to, yeah, it happens.
How fast it moves around.
Yeah, okay, how fast it moves around. Okay. Anybody else have a concern?
I can't tell by looking at it, but I probably should be concerned.
Okay, why should you be concerned?
Because I've just been having a good time.
Okay. Yeah, and you got around rather fast.
Yes, I did.
Yeah, and fortunately the lights were on. So you could see what was going on, because most, when we look at statistics, people are having sex with the lights off, right? So what do you see if the lights are off?
Not much.
If the lights were off, would you have noticed that boss lady had something that might be mysterious?
No.
Would you have seen that? Likely not, right? So sometimes we got to turn on the lights, all right, and to figure things out. So my dear, what do you think that represents as the starter of fun?
Yeah.
a big problem.
Okay, a problem. Okay, we can work with you and we can treat you though. Actually, there's different types of treatments that we can do for you. Any guesses as to what maybe that might represent?
What the treatment might represent?
What STD might represent? Yes.
No.
Okay. Anyone want to take a guess? What do you think? What could it be? We see signs and symptoms of it. You could touch it actually, and
It comes and goes away.
it could come and go away.
Oh, so, yes. But I can't think of it.
That's okay. That's okay. Human papillomavirus,
Oh.
which leads to warts. So, my dear, you've been passing around warts.
Cool.
Yes. Cool. Cool.
It was George.
George, did you even go over there, or did you stay away from her?
I went over there. She's like the first person I ran into.
Okay. And you jumped in? You partook? Okay. And how are you feeling about that, George?
I don't know.
Okay. Okay.
Outnumbered?
Outnumbered? Okay. How are those of you that have that feeling right now?
Well, probably all of us that had these little black things floating around.
Question, did Cindy know she had warts?
She had signs, actually. That is
Okay.
because she had apparent signs there, then you partook and shared with her,
I
then,
was trying to get you.
yeah, out of it, yeah. Although the reality is that HPV doesn't always have signs, right? So this form and this strain did. And we have a couple strains of HPV that cause genital warts. So this is a representation of genital warts, although it is pepper, okay, in this demonstration, right? So how do we take care of those genital warts, those of you who have it? What will we do for you?
Treat it.
How do we treat it?
Antibiotic?
No.
Salve?
Maybe? Mm-hmm.
What is that?
Salve or like an ointment, a medicated
yeah.
ointment, okay?
Burn those babies off.
Yeah.
Ooh.
Laser, we can cryotherapy, we can freeze them off.
Are they virus?
Yes. Yep, it is a virus, and it's one of those viruses that is shared with skin-to-skin contact. You don't even have to have penetration in this case. It's just touching, and you can pass it off to somebody else. Okay? So what kind of prevention messages do we have around that, or what kind of opportunities do we have to prevent this from actually happening?
Condoms.
Okay, maybe so. I would argue against that, and I will in just a second.
Talking to people?
Yeah, Gardasil, the vaccination. So who's supposed to get the vaccination?
Teens.
Teens.
Men and women.
Younger than, yeah. So the recommendation is for 9 to 12 years old. And what we're trying to do is we're trying to target those youth before they're ever sexually active, before they ever come in contact with it. So the Gardasil protects us against 4 strains of HPV. 2 of them cause cancer in women, and 2 of them cause genital warts. So if you have all 3 of those vaccines, because it is a series, then after that you should be safe. But that's not what the reality is. That's not what we see in our communities. Sometimes maybe they go in for their first shot. Maybe they go in for their second shot, but they don't go for the third. Maybe they've already been sexually active, and now they're coming in for the shots. So right when the vaccination came out, and there was a lot of, hub-did-hoo, we had people say, you can't get the shot because you'll die. And in the study,
That now.
right, yep, and there's
Because
more.
my daughter had the shot right when it first came out.
Uh-huh.
She was 9 or 10, and
Yeah.
now I'm like, oh my God, did I kill her?
Yeah, no, yeah, and so the studies are actually
yeah.
showing that it is amazingly effective, amazingly effective. Now, with the first study that came out with that, I don't know if you guys know research, but no matter what, if you guys are all part of my research group and one of you dies, I've got to report that, right? Well, in this case, when that study was being done, one of the youth died. She died in a car accident. She didn't die of the vaccination, but then it had to be reported as passing because she didn't make it through the study. So that blew up into the vaccine killed her. No, it was a car accident that actually killed her. So digging deeper sometimes is the case. So, but our research is actually showing the effectiveness. We're not seeing as much cancer in our 20 to 30-year-olds as we did 5 and 10 years ago. It's dramatically decreased. But there's still people out there, right? And there's people that we mentioned recently divorced, so now possibly entering into the world. Could you be exposed now to HPV? Not recommended because we're older, but is it something you could ask for? Yeah, and there's some docs that will actually do it because now you're in the field and you might be exposed. Do you want cancer? Something you have to ask yourself. Do you want genital warts? Doesn't sound like much fun, but many of you have it. You said you were lucky. But now we know.
Yeah, but I know who the carrier is.
Right, that is true. So treatment-wise, we will try to laser them off. We try to burn them off, cryotherapy. We can put some ointments on it, but they kind of come and go. But they can get really bad. I mean, it can look like a cauliflower growth, and it can cover genital areas and everything else. Now, when it comes to the condoms, do you think the warts just grow on the shaft of the penis? No, they don't. So they like testicles. They like the backside of the testicles all the way through the anus. So on a female, can you imagine where they would be there? So even if a male was wearing a condom and he had sex with his partner that had the warts on the outside, he would be exposed there, right? And the scrotum area could be exposed and so forth. So really, the condoms don't do a whole lot. I mean, it's better than nothing, right? But in this case, it's just skin-to-skin contact. So, my dears, you guys get to live with this for the rest of your life. We can't cure it. This is something, as the symptoms come, you may have to get those treated, but you maybe only have one outbreak and be fine. I don't know. Everybody's just a little bit different. Okay?
But the big thing is also the responsibility of the person that knows that they have it and having to tell whoever in the future that they have it.
Right. So how does that work?
Is communication strong with the young people?
No. No.
Or not?
No. I mean, high school boys will be like, oh.
Oh,
I
high
got-
school boys, no,
I got
no,
with
no,
her.
no. I'm thinking college,
College is the
dating
same.
the 28 to 34-year-olds or something.
Yeah.
Are they communicating, or is it just as horrible then?
I think it probably depends upon whether or not they sought care. I think that's the big thing. Like when it comes to warts, I've worked with people who never actually went in. They just said, no, I got warts, they come and go, and I try not to pick at them. Or some of them will actually say, yeah, I've been picking at them like crazy, or whatever. But I would say that the ones I've worked with who have sought care realize that they have that responsibility to say that. But there's not a whole lot of accountability to that. So what if I did have warts and I gave it to you? What are you going to do about it? Takes two to tango. So part of my message, right, you may not know right off the bat.
We just played.
Right, you guys got around fast. You didn't know do you know all your partners? Okay, well, at least you know them. But if the lights were off, would we have known them as well? Or if this was at the bar scene or whatever that could be, we might not know necessarily what's going on. So my message for that is that it takes two to tango.
Right.
And so as much as somebody may know or may not know if they have something, it's just as much the other person's responsibility to ask those questions too. Now you guys didn't even say no to her. Or did anybody say no? Nobody said no.
I said no to him.
Okay, good. Why did you say no?
Because I saw Pepper.
Okay.
But I knew that I could because of last time.
So she's been part of the game, so she saw. Okay. But that takes a lot of strength. How many people can say that for themselves? Like, I adore this person. I don't care, so what? It looks like an ingrown hair. Like, all right, big deal. And then all of a sudden something comes up of it later. So having the strength to acknowledge, you know what, it doesn't look quite right just right now. Maybe we should go in for some screening and make sure everything's okay because you know what? This matters to me. And so good for you for the strength, but cheating because you're using your past experience. Okay, so there's the warts. I apologize that you are warty. I promise, though, that when you're done with this demonstration, you will walk out of here wartless, at least from this experience, okay? I don't know what's really going on, okay? So I want to go through now and find out if maybe you were exposed. And I'm going to use chlamydia as my disease because our chlamydia rates are through the roof. I get to report on the facts that American Indians have the highest numbers, and we can talk a little bit about that, but we go neck and neck with Fort Peck Reservation on my reservation, and there's reasons behind that, but chlamydia is pretty dang common. So, do you think you have chlamydia? How many of you think you might have
First
it?
off, I forget what chlamydia is.
Oh, what is it?
I've heard of
Okay.
it, but I forget.
Okay, so let me back up just a tiny bit. If I was to give you an STD or an STI, which would you choose? So what is an STD?
Disease.
Disease. Do you want the disease or would you want the STI, I standing for infection? You'd rather have the infection? Okay, so chlamydia is an infection.
Okay.
If we know you have it, we can treat it. It's a bacteria. And what it wants to do to us girls, it wants to get inside of us, it wants to go through the cervix, get through the uterus, and go for the fallopian tubes. Fallopian tubes is where it loves to hang out. And what it wants to do inside there, as any bacteria wants to do, is just survive. So when it gets inside there, it starts chewing up the fallopian tube, and then has its babies. And then there's more bacteria, and then those other bacteria come along and whatnot. So imagine if all those bugs were chewing up on my arm. What's going to happen to my arm?
Scars.
Okay, before the scars.
Oh.
What?
Holes?
Holes, sores, redness, bleeding maybe, right? And then it leads to scars. So what happens is somebody who may not know that this bacteria is going bonkers in them, this is all happening, and that scar tissue happens, and we don't find out until we're trying to have a baby. Okay, because now the fallopian tube is scarred shut. Sperm cells can't get through, and the egg cells can't get through either. So chances of a baby go down. And what we're hearing now is that if you're infected 3 times with chlamydia, poof, you're probably done. Infertility, very high. But you can be infected with chlamydia 1 time and be infertile, not knowing it. So that's why we try to talk about how important it is to go in for testing, even if you don't have signs or symptoms. And especially with chlamydia and gonorrhea, girls, we don't show a lot of signs or symptoms. This is a point where I want to be a boy. Because if there's a bacteria in a boy, it wants to crawl up their urethra, right? The glorious thing about a urethra is they have to pee through it, right?
Washes it out.
Well, it can, yeah, to a certain degree it can. It's, but if it is chewing on in the inside of your urethra, it burns. So they're like, ha, that don't feel good, then they tend to go to the clinic. Or, as one of my last high school students said, I just pissed it out. I was like, what does that mean? He's like, I drink 5 gallons of water every day, so I could get it out of my system. So he doesn't have signs or symptoms now, but that's what he was dealing with. So because he was afraid of how to be tested. So we'll talk about that in a second. So chlamydia is a bacteria. You can get treatment. If you get the treatment done, taken care of, and you no longer have that STI and it doesn't turn to an STD. If you have chlamydia and you didn't know it and you let it live and it does its job, then it could turn into an STD. Could lead to pelvic inflammatory disease and other issues and infertility. So we want to treat it. We want to get it. We want to head it off right off the get-go.
So as a woman with an infection, would you have fever or anything that goes along with
Typically, these are asymptomatic, no symptoms, none. And I would say that that's true for at least of 50% of my clients. That they're like, no, we just came in because your presentation, and I'm at risk. Because I try to push, like, I don't care, what you're seeing or feeling. I care about, are you at risk? Because being at risk is a reason to get tested.
Right.
So that's what I tell them, just come in if you're at risk. So, no, nothing. And then we call them back in and say, you got it. Yep, so we need to treat you. So, who's got chlamydia here? Anybody? Want to take a stab at it?
I could.
You could, okay? Could have it, okay? Anybody else? So 2 of you think you might have it. So before that, do you know where to go to get tested?
Health department.
At the health department, okay.
I go to my doctor.
You'd go to your doctor, okay. Is cost an issue for you?
Yes.
Okay,
Yeah.
okay. So cost could be, let's see, is there a free place to go?
Planned Parenthood, maybe?
Planned Parenthood?
How about
Partnerships,
Blue
maybe?
Mountain, maybe.
or the
Partnership?
AIDS Alliance? Do they?
Open Aid Alliance is testing for chlamydia and gonorrhea now as well.
That's
Yes.
$20 though.
Okay, so it's not free. Okay, but thank you. Good. Because there's a cost associated with it. We got to pay for that somehow or another. Okay. So there are places where it's free, and then sliding fee scales, like the health department and Partnership Health and other places. So, but going to your doctor, great. I'm glad you went in for a test. So, are you ready for your results?
Yes, please.
Okay.
Holy moly.
Surprise.
Okay, so you went in for your test. Are you ready for your results?
I am.
Okay. You do not have it. Rock star. Okay, now the rest of you, would you know where to go to get tested? Did you know that before we announced
Now,
them?
what is the test?
What is the test? How do we do it? That's a good question.
Smear, right?
Okay.
In a cup.
Pee in a cup.
You could pee in a cup.
You can also swab.
You can swab, a vaginal self-swab. So we have swabs that we give ladies, that's the swab that's about that long. It's in a package, and then we send you to the bathroom. You insert it and swirl around for 30 seconds, and then put it into test tube, and we send that off, okay? If you go in for a pap smear, what does a pap smear actually test us for? Cancer. So there's times when we actually go in for a pap smear and there's not going to be any signs of anything, an infection on the outside of our cervix. Because remember that what chlamydia wants to do is get through the cervix and go. But there are times, like literally, I mean, it's no question. You see it right there in the cervix and it's just like, yeah, we got a problem here. So pap smears are only going to check for cancer. So it's really important that you let your physician or your provider know, hey, look, I don't know what's going on. Check me for whatever you think I might need. I know in most doctors' offices, they'll do what Caitlin just suggested, is pee in a cup, and you don't necessarily know what your pee's going for. You're just like, oh, it's my woman's check, so I pee in my cup and I get swabbed and whatever else. But we can do a vaginal self-swab. So a lot of that is just about empowering the women to know what are you being tested for. Okay? So we can pee in a cup. We can swab. The doctor can swab as well. But I'm going to throw a curveball. What if you're having anal sex? Well, those tests show it.
Maybe not.
Hard to pee in a cup.
Yeah, for your anus. Yes, you're absolutely right. I agree completely. Okay. So if we are having anal sex, that's another thing that we have to tell our providers. I am having anal sex, so that's where they need to go. They need to do an anal swab. Okay. What about oral sex? Because we can actually get chlamydia and gonorrhea of the throat as well. So, you can't just pee in a cup and say, oh, I don't have chlamydia anywhere in my system. It just doesn't go run into your pee kind of thing. So being honest about what types of sex we're having is going to be more informative for you going forward. And your partners. What kind of sex is your partners having? And what are they bringing to you? So I'm assuming all of us know now where to go get tested, how to be tested, so let's find out what your results are. Are you ready for your results?
Yes.
Okay. Are you ready for your results, George?
Yeah.
All right. George, just warts, yes! Actually, I would probably go for the chlamydia over the warts, but that's okay. Oh, darn it. And she kicks her. She just totally, take that! All right. It could be. Are you ready for your results? Okay.
You have it.
Yeah? All right, are you ready for your results? Yeah. You got both. You think you have it too? I'm going to stop. Why do you think you might have it?
Because I shared.
You were sharing, okay. You guys shared. Yes, ma'am, you do have it. All right, I'm going to take that drop there.
Thanks a lot.
All right. Okay. And you're double-fisted now.
I know.
All right, you got extra fluids.
My test came back.
So no chlamydia there.
So it's not from you.
Oh, good.
Nope.
Not for me.
Okay. So where do you think? Okay, so where do you think it came from?
Look at you. I think I had it.
You think you had it? Why?
I had an unlucky number.
You had an unlucky number. Okay. So why do you think you started this?
I don't actually know.
You don't know. You just kind of feel it. You're like.
I just feel guilty.
You feel guilty. Okay. So, Ari, tell me your number on the bottom of your cup. You are it.
Oh no.
Yes. You in fact are it. So come stand beside me.
Oh no.
All right. So what happens now is Ari has been identified as being positive for chlamydia. So this is a communicable, reportable disease in Montana. All right. So we're going to ask Ari, where have you been and who have you been with? So I'm going to ask you, do you recall your partners?
My first partner was you.
Okay, I helped you. Okay, next.
Then it was Seisha.
Okay, come on over.
And then Brenna.
And then Brenna. Yeah, nobody else.
No.
You follow the rules well. Okay. So these three people now would be contacted and saying that they've been named as a contact. They will not say that Ari was the one who did this to you. But if I've only been with Ari, am I going to figure this out? Mm-hmm. Yeah, so sometimes everybody gets really mad, like, they're breaking HIPAA and they're not confidential. Well, the reality is you only knew because you only had one partner, okay? But you guys had 3 or 2 other partners, right? So you don't necessarily know, but now you've got the phone call, so we're going to ask you as well, who were you with? And so we're going to ask you to name your partners.
Eileen.
Eileen, okay.
And Cindy.
and Cindy, and they're both positive. Okay, so we're gonna just, can we scoot around? We'll just kind of come around this. Okay, so, and then who were you with, my dear?
I was with Pam and Caitlin.
Pam and Caitlin. Okay, so maybe Pam and you weren't, so you might have got it at the end. Yeah, but Pam and Caitlin, guess what? You're going to still get the phone call. Okay, because she's going to name you as a partner, so you're going to get the call. At the health department.
Do we still get tested?
So it kind of depends. That's a good question. It kind of depends. Some health departments.
I could take this in and.
Right, and I would show them your warts. Absolutely. That would be important information for them to take with them. Some health departments will actually say, yes, please. It would be nice if you got tested too, so we could find out. But others may just say, you know what, you just been named as a contact. We're going to treat you anyway. So you'll get medication even though you don't have it, but you'll be medicated. Now, if you're tested and you were positive, you get to start off as our source patient next time, just as Ari did last time.
With the phone call.
Yes,
yeah.
And we're going to ask you where you were at. So, but if you got tested and you were negative, buck stops right there. We don't have to contact any of your contacts.
How long does it take to get results back?
Good question. Anybody want to try to answer that?
24 hours.
A little bit more.
A week.
I don't know, this week.
Yes, it is not a rapid test. Gosh, it would be nice if we could walk through the high school. Rapid test, everybody, Pete here. That would be super awesome, and we'd probably stop things before the weekend, right? But that's not the way it is. Now we can do a rapid test for HIV and hepatitis C, anywhere from 10-minute test to a 20-minute test. In this case, my experience to the state lab has been 3 days. We tell our clients 5 business days just to be safe, because the last thing we want them to do is like, you haven't called me back, what's going on? And we don't want to have them have that fear. So,
well, if you wait any longer, they're going to have sex with someone else anyway.
Probably. Yeah, that happens. Yeah, or maybe they have 7 more partners this weekend. Yeah, yeah. So, who does that? It's quite amazing. Some of our trees or source patients, and then we tree them out as to how many people they've been with, could be up to 37, 50, yeah, in a given time. And we're talking anywhere from high school students, college-age students, and I've got one tree that's in the 30-year-olds, that's that case, but they reach into the 60-year-old people as well. So it's like nobody's immune, it's just there. So, but you guys are infected now. So now, because we know you're infected, we need to treat you. So what are the options for treatment with chlamydia? Anybody know?
It's an antibiotic.
Yep, yep.
And it's a 7-day.
Yep.
Or it's a one-time.
1 dose or 7-day dose, okay? And what other instructions come along with your antibiotic?
Probably wait so many days before having sex again.
Okay, that is one message. What's another message that goes? Not necessarily retesting.
Take the full amount of antibiotics.
Okay, yeah, you definitely want to take the full amount, so I guess that could be another one. There's one that's still missing. There's another message we want to make sure that you get. Because you could go out, like you just suggested, and go and have sex with everybody else underneath the sun, right? So we're going to tell you, we want you to take your full dose. In the meantime, no sex for 10 days. And your partner needs to be treated as well. Okay? Because if your partner's not treated, and you wait the 10 days, yes, you might be free of chlamydia, but what do you go back and get? Is you get that. So in our state, we don't have the option of like giving you medication for your partner. We still want your partner to come in. Other states are just doing this. So if you're positive, how many people have you been with? All right, you need 4 doses, go give them to your 4 people. That's what other states are doing, because we can't send all these nurses. We can't send all these nurses chasing everybody. I mean, like literally, sometimes we have to chase them down to Dairy Queen. And we'll be like, school's out, 4 o'clock, let's go there at Dairy Queen because there's a $5 special. And the nurse will just sit there at Dairy Queen and say, so are you George? All right, George, come with me. And they'll say, George, come with me. I've been trying to find you. But in this case, if it's chlamydia, gonorrhea, HIV, if you keep ignoring us or we keep trying to reach you and you keep trying to hide, I can actually call the police. And I could have the police come and escort you out of your classroom or out of your workplace and say you need to come to the health department or whatever else. And then we can do that. We have the right to do that. So that scares people. Like, my next step is to call the police. So either call me or I call the police. And then, ironically, they all show up. So we have to reach out sometimes by Facebook, because many times we don't know who we were with. Now, none of you said you forgot who you were with. And typically what I do in groups is I say share with 5 people. Okay? Any guesses as to why I might say 5 people?
Because then you might forget who they're with.
Okay, maybe. I would agree.
Average amount of partners?
Yeah, of whom?
Kids that age?
Of high school students.
Yeah.
So what they did is a study with high school students and said, okay, all you guys are sexually active. All right, how many partners do you have at the day of graduation? And the average number was 5. So that's why I would say 5. So then what would it be like in college situations? It goes up. That's all I'm going to say, is it goes up. So right, I said 3 here because of the size of our group. If the group was bigger, we would actually add another chemical to make another reaction, and we would have had some white or some brown floating around in there too, and you would have maybe come up with 3 of them. Not only did you get the warts, but you got chlamydia and you got the HIV. Okay? We don't have a lot of HIV in our communities, but it's still here. We have a lot of, some of our newer cases of HIV are being spread through the internet sources. So they're reaching out through Manhunt, through Craigslist to find anonymous partners. And we've had married women who found out they were HIV positive because they didn't know their husbands were doing something else on the other side with another man. Mm-hmm. So these things are, I mean, it still happens all the time. 2 weeks ago, I had a gal that's been married for 35 years. And she's got chlamydia like crazy. And her husband said, we got that 20 years, you know, I had that 20 years ago when I was living so-and-so. She's had it for 20 years. It's like, chances are so slim. I called my doc out of Seattle just to be sure because I didn't want to tell him wrong information. But the chances of that happening is pretty dang slim. So chances are that somebody was stepping out in that relationship. It doesn't just show up kind of thing. So I am sorry that you were infected. I am glad that you sought treatment and that you're not going to have sex for 10 days. For some of you, that might be very difficult. Okay, some of us that are married, we're like, we practice abstinence, right? No? Some of us? I jokingly say that because I feel like sometimes I'm in that boat. But, so you're not going to have sex for 10 days. You're taking all of your medications. And what was the other? I'm missing a boat. There's one more.
Call.
And your partner is being treated, okay? And that timing is similar, okay? So your partner needs to wait the 10 days too. So if I started my treatment 5 days ago and they're waiting, then I need to wait 15 days because we need to make sure both of us are in the clear. Somebody mentioned test for a cure, and unfortunately that's really tough because what we look for in the test are like remnants of the bacteria. So they actually could be in our system for up to 3 months. So if you tested in 1 month from now to say, okay, am I good? It actually would still show up. So we wait at least 3 months to retest people if they want to retest, but quite honestly, there's just so much of it, we don't even offer it, really. But if you want to know, certainly you'd have the opportunity to come back in for a test. How are you feeling now?
Dirty.
Okay. Dirty. Okay. That's fair. Yes. How do you feel about that?
A little distant.
Okay, okay. And I'm really sorry.
Decision.
Yeah.
So nice.
Yes. Yeah, if STDs showed up as little dots on our forehead, that would be nice. You'd be like, green dot, watch out. Right? And you'd be like, oh, I'm not touching that. That would be great, but that's not the case. What's that?
Friends only.
Friends? Or are we seeing pockets of friends with benefits with all of them sharing everything? And like the chlamydia goes round and round and round and round. Okay, come in again.
Okay, so
Come in
after
again.
you've taken the medication,
Yes.
are they assuming that if you have done everything right, you are cured?
Yeah, oh yes, they are assuming, yes.
Is that like 99.9%?
Yeah, oh yeah, it's very,
or-
very effective if that is followed. The question is are you being honest enough to know that
Right.
that's the case, right? Or that your partner took all their medications too, if in fact you return to that partner.
Right.
So there's some caveats that are going to play in there, but yeah, no, once you've gone through your full treatment, it should be gone. Should be no problem. Yep.
You know?
Yeah. Gonorrhea, on the other hand, is a little bit more of a beast. It's stronger. Fortunately for us, there's a few more signs and symptoms, but not very many. So it's still, for girls, it sucks. For guys, well, they have much stronger signs and symptoms. So that's fortunate for you guys, but it's harder to fight. So we have to take an oral medication as well as get a shot in our butts when we have gonorrhea. And kind of chasing it down can be tough too because people don't have signs or symptoms. The other thing is we have there is a strain of gonorrhea that is resistant to our
I was
antibiotics.
going to say, has it become a bigger bug?
Yeah, yeah. We're not seeing a lot of cases in Montana just yet, but I know because the population I get to work with, they travel. right? I've got people that go into California, they're going to Seattle, and then they're coming back. Could they bring it back? Absolutely, absolutely. So we do have cases in Seattle. We have cases along the coastline. We had a lot of cases in Hawaii. So be careful what's in Hawaii. Yeah, it's not just the sun. So, so yes, so there's that concern as well, is that what happens if we don't have a medication for this and we have to deal with this? Because gonorrhea is a lot tougher than chlamydia. It does the same thing for girls. Wants to go for those fallopian tubes, count them out, take them apart. What about HIV? What do we know about HIV?
Haven't heard about it in a while.
Okay, haven't.
It's still out there.
Okay.
Yeah.
Do we have cases in Missoula?
Mm-hmm.
Okay, lots of cases, low cases. What do you think?
I think we have lots of cases.
Okay.
Matching the national average, I would imagine.
Okay.
Yeah.
Yeah, we're considered a low incidence state because we don't have a lot of cases. Our monies for HIV have just plummeted because they're really pushing the monies federally into the pockets, high incidence areas and so forth. But yes, we still do have HIV here. As of right now, we are sitting at 22 cases this year. Last year, we were sitting at 24 cases for the whole year.
For the whole state?
Yeah. New cases, newly diagnosed cases.
And are we
Newly
a low
diagnosed.
incident state because we're a low population state?
No, I just, in general, if you compare our population to our number of cases, we're still low incidence. Yep. Yep. So, but the numbers this year, right now, being at 22, and last year we were at 24, we're only in May.
Yeah.
We've got a lot more to go. So that, to me, that there's some fluctuation going there. Yes, we see it in our MSM population, which is referred to as men who have sex with men. But that doesn't exclude anybody else that sits before you. I mean, it's just whoever they're having risk with and who's willing to go in to get tested, because that's a hard part. So you may not have known where to go get tested. Imagine a population that is struggling with life, struggling with, whatever it may be. Do they know where to get tested, and do they have access to those resources?
Now,
Yes.
I don't know about Missoula. I'm fairly new here. Is it legal for hospitals to test? I mean, is it a general test that our hospitals do? I know in California it's illegal.
To test people unknowingly. So in the state of Montana, you have to actually still sign off that you're willing to take an HIV test.
Okay.
And so if you go into the clinic, watch for the itty bitty writing. I think it's size 4 font. At least it was when I went to my clinic visit last time. But it's right at the very bottom, itty bitty bitty, and then you see HIV kind of thing saying that you would have the test. So if you sign that, then you could be open to that. It depends upon the situation that you might be in as to why they may offer an HIV test. But to say everybody gets it, no, they wouldn't test everybody. There's got to be some reason for the most part as to why. Prenatally, though, we're doing a really good job. We're testing our prenatals for sure, but we have a lot of women that actually don't seek prenatal. So then we have that. But honestly, we've been really lucky. We don't have any babies in Montana born with HIV. Nice. We've had a couple babies that are now teenagers who were taken out of California. I'm sorry. Moms were addicted to drugs, and moms breastfeed for a period of time, and they were both infected with HIV through that.
Breastfeeding?
Through the breastfeeding. So
do you gather that information, drug using population as opposed to non-drug using population?
Yeah.
And so we're still a low incidence state. No eastern Montana. Well,
yeah. Oh gosh, all the fun in eastern Montana.
I know, there's
The oil fields are amazing. Yeah, yeah. Not only are we dealing with more sexual encounters, but we're also dealing with human trafficking, and we're dealing with prostitution because of, there's situations that I've heard of where the parents actually meet the person outside, they hand over the money, they go in, and their 13 and 14-year-old daughters are in the inside. So, there's lots of money. And now that's kind of settling down. Not to say that's not still happening, but that's settling down. But when we were talking about chlamydia and gonorrhea, the fires went out there. Syphilis, fires are going on out there. Were we testing as much for HIV? Not so much. But the hard part is that those people run off and they work in different parts of they come there to work, and then they're off in different parts of our country. So chasing them is really, really tough, not easy. So, yeah. The oil fields were fun. Yep, but need more lubricant, not oil, when it comes to that. Questions? Right now.
Can you be tested for other STDs without your knowledge?
No. No, you should be able to, say that you're going to be tested. I think sometimes, though, be careful of writing, when you sign in at a place, know what you're signing up for. And I think it's just, we've got to find a way to empower ourselves to ask, what are you testing me for? Because a lot of times, as you said, pap smear earlier, I don't know how many people I've worked with are like, yeah, I got pap smear, I'm fine, like I'm ready to go. Or guys will even say, well, she got a pap smear, her little card said she was fine, so she's good to go. And the reality is no. That means we didn't see cancer cells. That's all. So what else am I being tested for? I didn't know. And I really, before working in this, I didn't ask. I just assumed they're going to do everything that's right for me. So ask and find out. Because really, we can't test you for much. Yes, we can test you for chlamydia and gonorrhea. If we believe that syphilis might be an issue, we might test you for that as well. If we believe HIV might be an issue, we test you for that. Likely, you're not going to test it for herpes. HPV will show up with cancers, but we're not going to swab other things unless, if we see a wart, we could say it's HPV. But otherwise, no, there's about 25 others out there that we can't really do much about, and we can't test you for them. You're just going to have them and deal with them.
And I think
Yes.
Oh, sorry, go ahead.
Oh, I was going to ask, if you go in and you say, I want to get tested for everything, do they know what you mean, or do they just do the regular stuff?
So that's a great question, because I've told my girls, my high school girls or whatever else, say I want to be tested for everything and see what they say. And some providers are like, yeah, we'll do everything. And in my mind, I'm like, really? What are you doing? Because there's a lot of tests that's going to be awfully expensive by the time we get done with this, okay? You can have, in regards to herpes, you could have it for 5 years and your test is never going to show up positive. It's about 5 years of being exposed to herpes before a blood test is ever going to show it. So you might be running around, oh, I don't have herpes, but the reality is you do.
Get copies of your test results. So
Sure.
That'll give you the list of the different things you
Yeah,
were tested.
and sometimes that's exactly how people are finding out. They didn't even know they were tested, because then they ask for the results and to send, can I get the lab forms of whatever? But many people, I can even attest to this, I don't know how to read those suckers. When I went for prenatal,
Yeah, but you would
there's
be able to recognize the name.
maybe, but what's GC?
You're asking someone who doesn't know
Exactly.
what a herpes is.
Right. Okay. But GC is gonorrhea. So you wouldn't know that. You would have to do some research to figure out what that really is. And I don't think our medical system does a really good job of informing us as their patients as to what we were really tested on. You might get that long list, and here you go. And then you could spend another 20 days researching everything you were being tested for. Yeah, so it's hard. That part's really hard. I've encouraged them to say, test me for everything. Some people will say, oh yeah, absolutely. And then I've also said, okay, ask the question, what are you testing me for? And you're going to get completely different answers. So I want to know what you're testing me for. I want to know what that is and what that means. That's a totally different answer. And you might get those 4 or 5. Maybe they exclude the HIV because, you've been married for 20 years. Why would we test you? Not a big deal. Well, maybe something was going on. Or I think the other part about this is that when you guys fill out your forms when you go to the doctor, your risk, have you been doing this, have you been doing that? Sometimes we're not very honest there. And sometimes those questions actually don't open the opportunity to say something's going on. It doesn't ask, have you been cheated on? Do you feel like your relationship is in danger, or do you feel like there was extra partners in your relationship over the past 2 or 3 years? Those questions aren't there. So one of my fun stories to share with people is I came back from Nevada and I went to my OBGYN. New guy, he was just right out of college, so this was like, bring it on. So I had learned all, everything as I possibly could. So I went into my exam. He did the pap smear and he says, okay, just lay there for a second. We'll be right back. But in the meantime, do you have any questions before I leave? And so I sit up and I said, yeah, I had an orgy about last weekend, so last Saturday, and there was about 6 of us. And so, boys and girls and everything. And I'm not joking, his face went. He was looking at me and he didn't even move. And I'm like, so I'm just really wondering, should I be worried or should I just wait? Or, I don't notice anything. And I was just being sarcastic about it, but trying to have some fun with it too, but not laughing. And so he's still sitting there and I'm just like, looking down at him like he's gonna say something, and the nurse just literally is like, we are gonna go outside and talk about this and then we're gonna come back. You bring up some good concerns, and so there are some tests we'll probably do. So she literally lifts him up, picks up his jaw, and they go out. Well, so I'm in there and I'm just like, don't laugh out loud, because you don't want them to know, right? So they come back in and they got the tray of everything. I'm like, I'm nervous now because there's all sorts of things and gadgets. biscuits, right? Yeah, and I'm just like, holy biscuits. So here she puts that down, and she goes, all right, we're going to ask you to lay back down, and we're going to do a few more tests. And I said, well, what kind of tests are you going to do? She goes, well, you know, just the standard tests. And I'm like, no, 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 what kind of tests are you going to do? And she really couldn't come out and just, we're going to test you for gonorrhea, chlamydia, or whatever else. And I said, okay, before we even do that, I have to tell you that it's not true. I didn't have an orgy. I said, but you didn't ask me any questions, you know, about that. So if I did, there was no reason for me to tell you what's going on, and you would have missed it. You would have missed the opportunity to test me appropriately and give me what I needed for good health care. And so the doc was like, I am so sorry. Like, I don't know what, you know, why, you're right, I didn't. And I'm like, what did you assume? He's like, you know, to be honest, I assumed that ring on your finger meant you were monogamous, and, you know, it said you'd been married for so many years. I'm like, what does that mean anymore? I'm sorry, but I work with a lot of people that have experienced all sorts of cheating or whatever else. So as much as you can be married for a period of time, married is one word. Mutually monogamous is a different word, right? And I don't know what my husband does. I mean, I would assume I know what he does. I got my children at home to watch him, but I travel a lot, so I don't know what he's doing. So is there a possibility of it? And I just think that we need to keep that door open. It's my body. I want to know what's going on. So.
Sort of practical question about why wouldn't providers, because people aren't always honest or open about this, when they're testing, swabbing, why wouldn't they do every orifice? Why wouldn't they do your mouth, your anus, and your vagina?
Why wouldn't they? What do you think?
Money.
The cost of those tests, so for every single test, that's 3 tests for the chlamydia and 3 tests for gonorrhea. So I think what I would encourage is just to ask the questions of where it's happening, right? If you're having sex anal and orally, then we should check those, right? Yeah, we should do chlamydia, and yeah, we should do the gonorrhea, you know? But I think the asking those questions is tough. And especially of older providers. Yeah, exactly. And I think sometimes it's how you're presented with that. How would you like to be presented with that? Are you having anal, vaginal, or oral sex? You know, can you let that flow off of your tongue, or is it like anus? Yeah, are you having? Yeah, exactly. And when it comes to the paper, how many people want to mark on a piece of paper that's going to go in the chart? I have anal sex. You know, like yeah, like
that'll be saved somewhere.
Right, exactly. It accidentally falls out or something.
No, they're
like,
going to put it in a computer, and someone's going to hack it.
well, maybe, yeah. Well, there's fear there.
It's standard procedure. We swab everything.
Mm-hmm. Yeah, and you could. And whether or not, how do you afford that? Because that adds up
so
a lot
it's
really
not
fast.
the same test for all 3. What they need to do is adapt all 3 tests. So
You could
all
be
they
a
have is
millionaire.
you know, 3 cotton swabs in one thing, and it doesn't matter where it came
What
from.
orifice it was from, we got it. Maybe so, yeah. Okay, so you can make some money that way. But we want dibs. We want dibs on this. But I agree. I think our testing is moving forward. Sometimes we kind of get stuck in this mentality that, oh, it's just a vaginal sex and that's that. But we have to open our doors to possibilities. When I work with high school students, when I ask them what type of sex they're having, most of them will tell me anal sex. They're a virgin still because they haven't had vaginal sex. So that, to me, is alarming because that's the anus. Okay, so there's lots of, and she's come home and told me, like, they talk about it at school. So I'm glad I have a high school student to be my little mouse in the corner finding out what's going on. But at the same hand, how many of those students know what to do to prepare their anus for anal sex, to take care of it, or what's going on there? Many of us don't know. So, other questions or concerns? Because we're out of time, pretty much. Unless you guys have questions, I'm glad to answer questions. And I'm sorry that you were infected, most of you. I'm really sorry, but twinkle dust and everybody's going to be fine. I will take your fluids and everything's good, but I would encourage you that ask yourself if you're at risk. If I've had unprotected sex, okay, whether it's with my partner for years or whatever it may be, what type of sex am I having? And am I being tested in those areas? And if that's something you're like, all right, this is a concern, then that's an opportunity for you to ask those questions and seek the services you need because you deserve it.
Awesome.
Good point.
Yeah.
Is there like a little badge that you can get if you've been tested?
Like an I voted student.
Yeah, exactly.
Exactly.
We actually we talked about that with our health
wear
fair.
it every day.
I don't have chlamydia.
Good thing.
Yeah,
I want it dated.
yeah, exactly. Yeah.
Or stamp of approval or something like
Right.
that.
This is good for 30 days. Yeah, and that's the thing is that there's still a little bit of window periods with all of our STDs. So if you had sex last Saturday, then I would say I want to see you at 10 days post that exposure. Because if I test you, let's say today is what, Wednesday? If I tested you today, I might not catch it. Because the bacteria needs a little bit of time to work it up. Now, if you had symptoms, I would test you. But if you didn't have symptoms, I would say, let's wait 10 days. So I'll see you next week.
And so they don't have douches or anything that could take care of some of this stuff?
There are douches out there. The problem with the douches is that it hurts the other parts of the vagina and the wall, and it actually can cause damage there, which irritates it and ticks it off. So now if you're exposed to bacteria, it's like, bring it in. Because now it's got an open door. It's like, you just ticked off your vagina. Now I can get through. So there are people that will say, yeah, I douche every time I have sex. That's not a healthy solution. And the other part about that is pregnancy-wise, it actually can shoot the sperm cells or the bacteria or the virus through and gets into the cervix and goes into the uterus. So yeah, it's not, for pH balance and things like that, great. No.
This is so new to me.
No. This is absolutely the questions that we need to ask, because not everybody's going to know that here. So absolutely, it's not a silly question at all. But people do that and thinking they're being safe and being healthy. And the reality is they're probably causing more harm if they continually douche versus once in a while.
Killing the bacteria with it. That's what
The
it was
healthy
when
bacteria.
I was in high school. These
Yeah.
ladies would douche and stuff, and then they would kill whatever bacteria, the good bacteria that was
Exactly.
in them. And they'd be in a hell of a fix.
Mm-hmm. Yep. So true. Other questions or concerns?
It's a huge question. We could go on.
I know I can go all night long, literally.
Thank you
You're very welcome. Thank you for your time today. I appreciate it. I hope there was something that you can take away from it, and certainly if you have questions. I have brochures for the STDs just in general, the big old open ones, so you're welcome to take that. But thank you for being here and being infected. I'm sorry,
Yeah,
but
I know.
you're all good now.